we're going to be starting in about 3 minutes. So if you will just bear with me for about 3 more minutes, we will be getting this hearing started. Thank you. Good morning. I hereby call to order the budget hearing for the District of Columbia's Office on Aging for FY 2000. The mission of the District of Columbia's Office on Aging is to develop and carry out a comprehensive and coordinated system of health, education, employment, and social services for the district's elderly who are over 60 years of age. The District of Columbia wants to make sure that our elderly are properly cared for economically as well as socially. Residents are living longer, and we have to accommodate our elderly so that they may be able to continue to live a full life. We must work together so that our elderly will be healthy, happy, and productive citizens. From in-home care to state-of-the-art wellness centers, the District of Columbia needs to make sure that a quality system for delivering the services are in place, and that is why we are here today. First, let me apologize for the lateness of the hour. I'm sorry we were not able to start as anticipated at 10 o'clock, but I wear a couple of hats. one of which is the chair of this committee, and one that's very important is that I am the council member of Ward 8. And we had an event in Ward 8 this morning that I had to attend and was not on my schedule when I scheduled this hearing. So, you know, you always have to take care of home first. So I had to go to Ward 8 this morning, and when I left, the mayor was en route. So I apologize for having you wait as long as you did, and with no further ado, I would like to call Ms. Veronica Pace, the Executive Director on the Office on Aging, to the witness table with the persons that she has accompanying her.
Good morning.
Good morning. You may begin. If you'd like to introduce the persons at the table with you, you may do so now. And
yes,
then begin your
I would do that. Thank you, Councilperson Allen. For the record, I am E. Veronica Pace, and I am the Executive Director of the D.C. Office on Aging, having been reappointed to the position by Mayor Anthony A. Williams, effective January the 4th, 1999. With me today are Mr. Sammy Gawad, Program and Grants Administrator, Ms. Karen Bachwin, Long-Term Care Program Coordinator, and Mrs. Alethea Campbell, the Chairperson of our esteemed D.C. Commission on Aging. I am pleased today to testify on the D.C. Office on Aging's mandates and the office's baseline budget for fiscal year 2000, which totals $19,264,000 from the following sources: from appropriated or local funds, $13,315,000; from federal funds, $5,353,000; and from intra-district funds, $596,000. The Office on Aging is charged with the responsibility of assuring that a full range of services are available to the 94,108 elderly Washingtonians who are 60 years of age and older. Thus, the office offers programs for all senior citizens, but with a special emphasis on serving the vulnerable elderly and those who are socially or economically in need, particularly low-income minority elderly. The office's service delivery responsibilities are carried out in partnership with a senior service network of 30 public and private nonprofit community-based organizations and 2 contractors. These service providers deliver services to the elderly throughout the 8 wards of the city. 43,463 seniors, or approximately 46% of the district's elderly population, received one or more services provided by the D.C. Office on Aging Senior Service Network in fiscal year 1998. As Executive Director of the D.C. Office on Aging, I am to serve as the effective and visible advocate for older individuals in this city. This function is mandated by federal and district laws that establish the Office on Aging: District of Columbia Aging Act, D.C. Law 1-24 as amended, and the Older Americans Act of 1965 as amended, Public Law 89-73. Advocacy is synonymous with Mayor Anthony A. Williams' values of quality service for our citizens and performance accountability from us as public servants in the Williams administration. To advocate on behalf of older citizens is to see that our service delivery system is capable of delivering the quality of service that our elderly citizens require. To advocate on behalf of older citizens is to use various methods of service delivery to meet the unmet needs of an at-risk older citizens through nonprofit and for-profit service providers. As Executive Director of the D.C. Office on Aging, I'm responsible also for competent delivery of services provided through excellence in leadership, effective management, and quality performance. The D.C. Office on Aging's requested baseline budget for fiscal year 2000, again, is $19,264,000. As you know, Madam Chair, in the fiscal year 1998 budget, funds for the Office on Aging's programs and services were reduced by over $1 million. This reduction is being restored under Mayor Williams' leadership in fiscal year 1999, as a supplement in the fiscal year 2000 baseline operating budget request. Programs and services that were reduced and/or capped will be available. That means homebound meals, daycare transportation, and other important services. The fiscal year 2000 capital budget request is in the amount of $3,417,000 to construct the much-needed and much-deserved multipurpose wellness center in Ward 8 and to design multipurpose wellness centers for Ward 6 and 4 on district-owned land. The breakout is as follows. For Ward 8, $2,857,000 for construction, $280,000 respectively for 6 and 4 for design. The groundbreaking ceremony for the facility in Ward 8 is scheduled for October 1999. The Office on Aging has the unique mission of serving a largely non-working population that wishes to remain as independent and active as possible. Aging is a universal business. Everyone is doing it. Chairperson Allen and council members, we need and appreciate your support, and we urge you to advocate on behalf of the Office on Aging's fiscal year 2000 baseline budget request of $19,264,000 and the fiscal year 2000 capital budget request of $3,417,000, which we know must be passed by the Committee of the Whole and subsequently forwarded to the U.S. Congress. This concludes my statement, and I am available to answer any questions that you have and to provide follow-up information as well. At this time, I might also indicate that the illustrious chairperson of the D.C. Commission on Aging, Mrs. Alethea Campbell, has a statement that she wished to make as well.
Before Ms. Campbell starts, you forgot to say the illustrious chair from Ward 8.
As well, thank you. From Ward 8, yes.
Thank you. Good morning, Chairperson Sandra Allen and distinguished members of the Human Services Committee. I am Alethea Campbell, Chairperson of the D.C. Commission on Aging and a longtime Ward 8 resident. I am pleased to be here this morning on behalf of the D.C. Commission on Aging, and I thank you for the opportunity to make comments in support of the D.C. Office on Aging's budget request for fiscal year 2000. As you know, Title IV of D.C. Law 1-24 establishes the Commission on Aging to serve as an advocate for over 94,000 older Washingtonians and to act as an advisory group to the mayor, to the Office on Aging, the District of Columbia City Council, and the public at large in matters concerning our older residents. D.C. Law 1-24 mandates that the Commission on Aging represent each of the 8 wards of the city. To fulfill that mandate, the Commission on Aging established many commissions on aging to provide assistance and support to the commissioners in each ward of the city, thus assuring that the rights of older people are protected and that their needs are identified and met. Sitting behind me today are many of our commissioners on aging and several of our many commission members. Would all of our commissioners and many commissioners please stand? Thank you. We thank you for the sincere concern you have demonstrated for senior citizens over the years and for the interest you have taken in the Office on Aging. Your support and the support of the other members of the council mean a great deal to the seniors of this city. We support the Office on Aging's budget requests for fiscal year 2000. We have the utmost confidence in the Office on Aging's management of the seniors' budget. Under the leadership of Eva Veronica Pace, the Office on Aging is an agency the district can be proud of. It does an outstanding job with a very small and hard-working staff and a senior service network that reaches every corner of our city to ensure the delivery of quality programs and services to the senior population. I implore you to protect the Office of Agents and its
Ms. Campbell,
budget.
would you pull your mic just a little closer to you, please?
It provides a service to a population that is critical to the foundation of the city. This office services the people who built this city. The Commission is very pleased that the mayor kept his word and restored the $1.2 million cut from the Office on Aging's budget in 1998. Now we need your support. Every dollar in the Office on Aging's budget is well spent and matched or multiplied many times over by volunteer efforts. These city dollars are critical to enhancing the quality of life for all of our senior citizens and ensuring that the frail elderly live their lives with maximum independence and dignity. The Commission is eager to work with the lead agencies, the Office on Aging, and the community to meet the challenges of the 21st century. In September, we plan to host a citywide job fair for seniors. We will continue to promote healthy aging, work to prevent elderly abuse, highlight accomplishments of seniors, and advocate for their rights. On behalf of the Commission on Aging and all older Americans, all older Washingtonians, we urge you to support the Office on Aging's FY year 2000 budget request of $19,264,000. The vision of the Office on Aging and the community can be realized with the continued help and assistance of both the mayor and the council. Our dream is to make the nation's capital the model wellness centers in Washington, in the United States. The development of the Ward 8 Senior Wellness Center is one step toward that goal. As you know, the groundbreaking ceremony for the Ward 8 Senior Wellness Center will take place in October 1999. The additional monies being requested for senior wellness centers in Ward 4 and Ward 6 will enable us to move closer to our wellness goal. Your support of this budget will ensure the construction of the Ward 8 Center and the design of the Ward 4 and Ward 6 centers. We thank you for this opportunity to address you and the Human Services Committee of this most important issue. Thank you.
Any other testimony before we move on? Thank you both for your testimony. I have a few questions, not a whole lot, because most of it is self-explanatory, and in my written questions to you, you answered most of the concerns that we have. In your, it has been reported that the FY 2000 proposed budget includes additional funding for mandatory pay raises. What is the total amount of the pay raises? And please discuss how this pay raise will impact on your budget.
The total amount projected for pay raises is $138,000. That's what we have allocated, which includes mandatory step increases, potential promotions, and then the conversion of 2 part-time positions to full-time positions. We do not expect any negative impact on programs and services for seniors.
I'm sorry, I meant to recognize the presence of my colleague, Mr. Mendelson. Councilmember Mendelson has joined us. He will probably ask some questions in a few minutes, and then if he has an opening statement by the time I give him the mic, then he will do so. Why is the additional funding of $861,000 needed for community-based services?
The 861,000 is part of the 1.2 that is restoration, and we categorize our services according to the type of citizen or constituent or client that we are serving. For example, there's a category called in-home services. There's a category called center and community-based services. And these are the services that are available for any older person in the community that wants to use it, whether it's daycare, whether it's senior center, whether it's health education, counseling, literacy, use of the emergency shelter, health education, and promotion. And these are the services that really help to keep seniors vital, to keep them from becoming even more frail, and really to prevent isolation.
How are programs and services determined for each individual? Is there a process for determining an individual's needs? And please describe the intake process.
Yes, there is a process by law or regulation of the Older Americans Act. We must serve any older person 60 years of age and over who chooses to make use of our services. However, there is still an intake process, and one can enter the system either by coming directly to the Office on Aging for information and assistance and to be connected with the service right there in the community, or they can go directly to one of the lead agencies. We have 6 lead agencies. There's Bonnie Senior Services Program, there's Friendship House Senior Services Programs, there's Iona House Senior Services Programs, there's Project Keene, there's the Urban League, and there's Senior Citizen Counseling Delivery Service, for which you are well aware in Ward 8. So one can enter the system in a variety of ways. But yes, there is an intake form that is done on each and every individual. And if you'd like to see a copy of that, I do have a copy with me. But it certainly ascertains a variety of assessment information. It is confidential information. And based on what is gleaned from that initial screening, the determination is made whether the person needs a light service that's more appropriate for an independent, fully functioning individual, or whether or not they would best be suited for a service that is for a semi-independent or one even more dependent.
It has been stated that the Office on Aging provides funds to 30 public and nonprofit community-based organizations. Who determines which community-based organizations receive services, and how is the determination made?
The Senior Service Network is composed of community-based organizations that have a long-standing, verified track record in serving older persons and with quality programs and services, which are routinely monitored. The programs are audited both programmatically and financially. The Office on Aging has built the Senior Service Network in conjunction with our partnerships with community-based agencies over a number of years. So almost any entity that is providing a service to seniors in the District of Columbia, the Office on Aging touches in one form or fashion. Therefore, because we have built a quality senior service network, for the most part, we have continued to fund on a yearly basis through grants the Senior Service Network and the lead agencies as they stand to provide the full range of comprehensive and coordinated system of care, because that is what the Office on Aging's mission is. You cannot have a coordinated and well-functioning system of care if we are using a revolving door approach in and out with Our meals that are served, preparation of meals, that is done by contract with the management of Washington Center for Aging Services, that is also done by contract. So that means that they are put out to bid. And when the contract is let, there is a base year, and then there are 3 additional option years. So basically, a 4-year contract is in place, assuming that the proper performance and outcomes are delivered within the prescribed dollar amount. At this point in time, we find that we have a well-oiled, well-functioning senior service network, and we expect to continue that system in place. From time to time, as the budget allows, there may be some discretionary funds, and when that is done, we are able to bring in an additional service provider on a pilot, doing a pilot project, if you will. 2 other major entities that are part of, I mentioned the 6 lead agencies, and 2 other major nonprofits that we do business with, of course, is the United Planning Organization, Family and Child Services. There's also Legal Counsel for the Elderly, which is well known in the legal arena. Advocates for Older People, which operates out of George Washington University Hospital. But we have a system that we have been building since the late 60s with a very fine track record, I might add.
Could you describe the role of the citywide Gatekeeper Coalition? Once the coalition is formed, will this have an impact on your FY 2000 budget? And if there is an impact, how will the additional funds be obtained?
We, at this point, we do not have a coalition in place, a formal coalition, but over the years we have worked with a number of faith-based community organizations, such as the Washington Interfaith Network, such as the Church Association for Community Services. There are 11 congregations in which we actually have programs physically located in their buildings or in their structures. We have done, from year to year, sponsored various initiatives with church-based organizations and communities. We've done various programs, whether it's related to fraud, whether it's related to how to provide or develop or build a program in a congregation. But the bottom line is that this is a one-time effort that is done, and it doesn't seem to really carry over. And what we would like to do is formalize a coalition and really be able to have it staffed with at least one person who can begin to nurture the various congregations on an ecumenical basis. We are in this country facing, as well as in this city, a longevity revolution. Historically, churches have been able to step in and help fill the gap in terms of providing that network, that community of care for older people. Many of them serve older people. They're older people that built their congregations, and they know how to provide some services, but we could provide a lot of technical assistance to them, a lot of education, a lot of advocacy in terms of strengthening their programs and really helping them to understand what the evidence shows and the impact of longevity on health, because it is a serious impact. And we have really collectively and with all communities have to be about the business of teaching people how to stay well. Yes, we need to prepare and to deal with those who are growing older, because the 85, 75 plus, and 85 plus are the fastest growing segment of the elderly population. But we could do so much more in terms of helping people to stay well, helping people to prevent those historical diseases of aging that really call for limited functionality or end up in limited functionality. All one needs to do is to walk into a nursing home, spend some time in a nursing home, and you can't help but come out and wonder what could be done so that we do not have to build more nursing homes, but rather provide true community-based care where people can remain in their own communities. The support of the faith-based community and ecumenical approach is what is vitally needed here. It's part of that gap that needs to be closed.
How How was it determined that the in-home services should reflect 27% of the budget?
In-home services is that category of service that is labor-intensive. Some would argue that it probably should be far more than 27%. I would argue against that because regulation says we must serve all older people. And as I said, there are 94,108 older people in this community. But with the 27%, you're talking about in-home care, you're talking about homemakers, you're talking about nurse supervision, you're talking about geriatric nurse assistants, you're talking about a population of people that functionally have perhaps three or more limitations and activities of daily living, may need assistance with feeding, with clothing, with bathing. We look at the demographics, and as I said earlier, the age 75 and plus is our fastest growing. We now know that of that 94,000 seniors, about 30% are 75 years of older. We know about 9% and growing are 85 years and older. If you come to our centenarian celebration, you will see what we mean about longevity and what it means to live to be 100 plus. So we expect this particular category service to grow, and it is. We see it with homebound meals. There was a time when the majority of our congregate meals were served in our community-based sites. We now serve over 1 million meals a year. It's moving close to 50% in the home, 50% out of the home. And that tells you where the demographics are going and where the need is going to be. But by the same token, while that 27% of the slice, depending on how you look at it, may seem to be a large slice to some people, a small slice to other people, we have to keep in mind that the Office on Aging is not the only agency that serves or provides long-term care. A great deal of the care being provided to older people in this community is being funded from Medicaid dollars. And therefore, we feel that we can use our resources more for those people who are just over the poverty guidelines as a gap-filling service, because we know the others can be taken care of through Medicaid dollars. I hope I answered your question.
You answered me.
Thank
I
you.
understand now, and
Okay.
I think my colleagues will.
Yes.
Of course, I would say that I'm on the side of is 27% enough, but let me not do that. If you're satisfied, I will accept that. Of course, I've
Thank you.
been recently, I was in Texas with some people from all around the country speaking about the longer lifetimes of people. So it is a concern, not just in the district, but it's all over the United States, that we are trying to figure out some of the things that are going to have to be done that have not been done in the past, because more and more people are living much longer lives. They're taking better care of themselves. They're exercising, all of the things that help you to have longevity. And so that was one of the reasons I was asking, because even though they're doing things for longevity, there are some disabilities that will not allow our seniors to get out and get to their meals, or get out to do some of the things that need to be done. That does not mean that they're not going to live a long time, but it means that they're just incapacitated as far as coming out of their homes.
Absolutely, and if the council endorses our $1.2 million addition, that takes care of some of that.
How many full-time positions are currently vacant within the Office on Aging?
We have 2 full-time positions that are vacant, one on the appropriated side and one on the federal side.
I have one last question. In the council's calculations, or when we did the budget, we came up with, I guess it was a 2% cut overall, $199,000 decrease for the Office on Aging. Is that in the real baseline budget, or is that in the, we have 2 budgets we're looking at. So I saw that, it kind of confused me. Is that the 2% cut across the board that the mayor had talked about early on in the budget process?
No, one cut I suppose that you're making reference to is the savings that for us for the Office on Aging is approximately $246,000. I think what you're referring to now has to do with what is referred to as the alternative budget. But of course, we're not expecting to have that $199,000 cut simply because we know we have all our friends on the Human Services Committee and on the council as a whole. So we know we're going to get the $1.2 million, and that's what we are expecting to get. The mayor has done his part. You know, when the mayor was campaigning, the mayor made a commitment to seniors. And he said that I will put the $1.2 million back. He has lived up to his word. And I dare say every council person, and I say this very respectfully, and know that it will be taken in the spirit that it is intended, every elected official who was running also made that commitment. And so we know that they will do the right thing. So the Office on Aging is not concerned about the alternative budget. We know the proposed budget for the Office on Aging is what, Madam Chair, you are going to recommend and advocate for and send forth, as are your colleagues and the council as a whole, because the mayor has kept his word.
Ms. Pace, I'm not thinking about taking it out. I happen to see it on paper.
Thank you. Thank you.
I couldn't figure out what it was. I've had my staff like, what is this? Why is it even showing up? But of course, we had to do both
Yes.
budgets.
Yes.
And it happened
Yes.
to show up in the
Yes.
alternative. And I could not understand any minuses in the Office on Aging's budget.
Thank you so much.
That's
Thank
my
you.
concern, and that's
And
why.
thank you, Councilman Mendelson, too, because we know where your heart is, too. Thank you. Thank you.
Councilmember Mendelson, I have no more questions. Do you have any?
Well, I don't really have any questions, and it's hard for me to think of any after Ms. Pace speaking for me and the rest of us.
Thank you.
No, I do very much support the needs of our older citizens, and I did say very much last year, frequently during the campaign, that I support the needs, and this is not an area where we should be looking for cuts, but looking for providing what we can. Thank you.
Thank you. And I want to, you know, as a former member of the committee said, Councilwoman Ambrose, truly with the Office on Aging, you get the best bang for the buck. Our overhead, our administrative cost is less than 10%. I defy any entity, public or private, to match our administrative costs. 7% and only 26 full-time people. I have a staff that works night and day and support the Office on Aging and the seniors and the staff.
We're not supposed to allow clapping in the chamber, so would you please refrain from this point on from clapping in the chamber? Ms. Pace, I have never thought about cutting the Office on Aging's budget. As a matter of fact, we fought last year to try
you did.
to get the money back in that had been taken out. And my colleagues, speaking on behalf of my colleagues, I know they all feel the same way, that it is very worthy, a very worthy office, and we do not plan to touch your budget. We
Thank
don't
you
even
so
want
much.
the mayor to touch your budget, and we want to make that very clear that we did not want you included in the 2% cut across the board, and so you can have the support of this chair, and I'm almost positive, I don't think any of my colleagues would do anything to your budget. Thank you very much for your testimony this morning. And thank you, Ms. Campbell. It's good to see you as always. And as many in the audience that I can name, that I'm very happy to see here this morning and continue to doing the great work that you've been doing. Thank you. We will now have the Home Care Partners, Marla Lahat and Vanetta Winbush, to come forward. since there are two other hearings that I'm holding in the chamber today, we will be allowing panels 5 minutes and individuals 3 minutes to speak. We have one coming up in about 45 minutes and one starting at 2 o'clock. Good morning. You may begin by identifying yourself for the record.
Good morning, Chairman Sandy Allen and the Human Service Committee. My name is Bernita Wimbush. I live in Ward 5, and I'm 62 years old, and I have a lot of medical problems, including diabetes, arthritis, hypertension, and knee replacement, and including the fall I had on the Metro Access van 2 weeks ago, April 1st. I have trouble getting around my apartment and need help to do my shopping, cooking, laundry, and cleaning. When I leave my apartment, I need to use my wheelchair or walker. I also need help with bathing, dressing, and other personal care tasks. For the last 2 years, I've had a homemaker from Home Care Partners. The homemaker comes to my home twice a week for 3 hours at a time. She's able to help me with my personal care and in managing my apartment. I wouldn't be able to manage alone without her. The DC Office on Aging funds my homemaker service, although I pay a small contribution as well. I would never be able to afford the full costs for this service on my own, and am very grateful for the funding the Office on Aging provides. Even though I receive only 6 hours of service per week, it is enough to allow me to stay in my own home. There are other people, however, who need more hours and 1 day. I may also need more hours of service. Please continue to give as much funding as possible to expand these home care services as long as a long-time resident of DC. I want to remain in my home as long as I can. And I'm hoping also that you all will be able to keep our food program going and add on more, because when the person goes into the hospital, they have to wait, get back on the waiting list when they come out. And we need more funding for quality home care. A lot of them need in-home support training and management. We can't do it. They can't do it if they don't have the money. And it's also hard for us even to pay that little bit of money that we pay, because see, no thing is taken into consideration like your rent, your utilities. It just go up, and sooner or later it will reach whatever I get per month, and I can't pay. So please help us and increase the budget for Urban League and for the Home Care Partners. Urban League represent all of us in Ward 5. Thank you for your time.
Good morning, Chairwoman Allen and members of the DC City Council. My name is Marla Lahat, and I'm Project Director for Home Care Partners. Home Care Partners is a nonprofit home care agency which provides home care aid service to enable frail, elderly, and disabled individuals to remain in their own homes. Our home care aides provide personal care such as bathing, dressing, and toileting, as well as housekeeping, shopping, and meal preparation, and you just heard about that from Ms. Wimbush. One of our most unique programs is the All Care program, which specializes in providing home care services to people with Alzheimer's disease or other memory problems. That's a joint program of Home Care Partners and the Visiting Nurse Association. Through the generous funding provided by the D.C. Office on Aging, these home care programs are the only home care programs that offer services on a subsidized sliding scale basis designed to make them affordable for even very low-income individuals. Indeed, some of our elderly clients pay as little as 50 cents an hour as a contribution, but almost all of them make an attempt to pay what they can. They would never really be able to afford the full market cost of $15 to $20 an hour. The D.C. Office on Aging's funding allows these people to remain in the setting that they overwhelmingly prefer, their own homes. In recent years, our All Care program has also been able to reach out to a very challenging group of residents, those who live alone, who have Alzheimer's disease. The safety and care issues are enormous for these clients, yet the flexible and specialized nature of our services and the funding that we receive allows us to serve these people and to keep them in their own homes. Again, the D.C. Office on Aging has been a pioneer in this field by funding this unique program for clients with dementia who live alone. The program has received national recognition and was recently featured in a training video from the National Alzheimer's Association. Office on Aging programs do not stand alone, and often collaboration among services is the most effective way to support an older person. Consider the case of Mrs. G. She's 86 years old, she lives alone, and she is adamant about staying there. She has Alzheimer's disease. She's rather functional, and yet in the late afternoon, she wanders. She goes out of her house, and this presents a real safety risk. In collaboration with Adult Protective Services and the daycare program in the neighborhood that the Office on Aging funds, we've been able to work out a plan for this lady. She now goes to daycare every day, and at the end of the day, the home care aide meets her there, brings her home, prepares her meal, settles her in until her nephew can make sure that she's safe for the night. But she remains in her home. She stays there by herself. Fortunately, the D.C. Office on Aging, under the very capable direction of Ms. E. Veronica Pace, has been a model of efficient government. It serves as an outstanding example of how partnerships between government and the private sector can best serve the needs of our city's frail and vulnerable residents. By funding essential services for seniors in their own homes, the D.C. Office on Aging helps to prevent costly nursing home placement. Please continue to support the D.C. Office on Aging's budget so that programs such as All Care and other home care programs, which are essential to the survival and well-being of our seniors, can continue. The D.C. Office on Aging is an agency which truly works for the residents of this city. Thank you.
Thank you. I don't have any questions. I just want to thank you for your testimony. Councilmember Mendelson.
Thank you, Madam Chair. I didn't say much earlier because I didn't think I needed to, but I do feel I want to say something now. I do understand how important these issues are and how important it is that people are able to stay in their homes as long as possible. My father, who's now 81, had a stroke a couple of years ago, and we've done everything we can to make sure that he is able to remain living independently. My mother was very active with working with issues involving nursing home reform and nursing home scandals. So I do understand how important it is, and I view this as a quality of life issue. You know, those of us who've campaigned talk about quality of life, and oftentimes we're thinking about things like street trees and potholes and so forth, and those are very much quality of life issues. But it's also quality of life that as people get older, that they're able to live in dignity and live at home. So I do want to acknowledge that. I try not to hog the microphone too much during hearings. I think it's important that we let everybody speak. But I didn't want that to go unsaid. Thank you very much.
And I want to thank Ms. Winbush for coming in and giving us her testimony this morning. And we will not be cutting the Office on Aging's budget. Thank you. United Planning Organization, Ms. Gladys Mack and Wayne Thompson. Good morning. Would you please identify yourself for the record and start your testimony?
Good morning, Chairwoman Allen and Councilmember Mendelson. I am Gladys W. Mack, Deputy Executive Director of the United Planning Organization. Our Executive Director, Benjamin Jennings, wanted to be here today, but he is out of town. We appreciate the opportunity to appear before you today and to give testimony in support of the FY 2000 budget for the D.C. Office on Aging. With me at the table this morning are Mr. Wayne Thompson, who is the Director of the Office of Operations, and Ms. Monica Nguyen, who is Manager of the WETS program. In the audience are Ms. Olivia Powell, the Director of the Weekend Nutrition Program, and Ms. Liz Baycott, the Director of the Minor Home Repair Program. UPO, the Community Action Agency for the District of Columbia since the declaration of the War on Poverty in 1964, has enjoyed a number of successful collaborations with the district government. In addition to our work with the Office on Aging, we are currently working with the Department of Human Services, the Department of Employment Services, the Department of Recreation, and the public schools on projects involving thousands of citizens from infants to seniors. In addition to our collaborations with D.C. government, UPO works with a vast network of agencies and programs, which includes 6 Head Start delegate agencies, 7 early childhood development centers, 7 community-based delegate agencies, 3 special emphasis organizations, and I won't read them all, they go on and on. Despite the many program changes that have occurred over the years within UPO, our relationship with the Office on Aging has been extremely helpful and steady. The relationship represents one of UPO's longest collaborations and one of the most heavily used by citizens. UPO and the Office on Aging have been partners throughout the existence of the office. We have been there in the years when the office was growing, and we have been there when growth slowed, and we have been there when the cuts came. Mrs. Pace and her staff constantly work with us in our mutual efforts to maintain high performance standards, and we would like to commend her on her fine work. One of the statistics that underscores the importance of the work the Office on Aging does is the growing number of elderly citizens in this community. With D.C.'s population drain in the last 2 decades to just about 1/2 citizens, our elderly population of 94,000 represents nearly 1/5 of the population in our city. That means that 1 in 5 persons in this community is statistically regarded as elderly. We therefore enthusiastically support the mayor's budget of $19,206,000 for FY 2000, especially the restoration of the funds that were reduced in fiscal year 1998. These funds will enable UPO to continue the wide range of services that we are currently delivering and hopefully offer some improvements. I'd like to take a minute just to name the programs and some of the performance indicators that we are achieving. Our largest program by far is the Washington Elderly and Handicapped Transportation Service, or WETS, which has an Office on Aging budget of approximately $1 million. This program operates with a fleet of 21 vehicles and provides curb-to-curb service, transporting seniors to their medical appointments, daycare programs, and other important appointments. The UPO Transportation Manager, Ms. Monica Nguyen, and her staff face tremendous challenges every day, overcoming inclement weather conditions, equipment failures, absenteeism, traffic congestion, etc., and do an outstanding job in assuring that patients and customers arrive on time for their critical, sometimes life-sustaining medical appointments. In fiscal year 1998, WETS provided 124,288 units of service to 793 customers. For persons who are mobile enough on their own and do not need the van or the ADA-equipped vehicle for transport, the Call and Ride program is a taxi service that provides the seniors with vouchers that can be used for participating cab companies. This program provides wide discretion to the seniors in planning their own trips and setting their own schedules. In fiscal year 1978, 728 seniors successfully used this service to visit their doctors, clinic appointments, and other senior programs. The Home Delivered Meals program delivers hot, nutritious meals to seniors who are confined to their homes and have no one to prepare their meals for them. This program, like WETS, is vital in its ability of seniors to live on their own. Successful service delivery presents many of the same challenges as the WETS program. However, the seniors always get their meals. In fact, the number of meals that have been delivered has increased slightly over the last 2 years. We are currently serving 1,090 customers with 186,495 units of service. My time is up. I'll summarize quickly. I was going to mention the Weekend Meals Program, which is also a staple, and the Senior Citizens Minor Home Repair. In summary, we are very enthusiastic about the support that we get from the Office on Aging, and we look and also the committee, and we look forward to continuing to work with you. I just want to take 1 minute to say that UPO is celebrating its 35th anniversary this year of the War on Poverty, and we will be having a number of celebrations throughout the city, and we would like the council, the chairman and other members to be involved in that activity. Thank you very much.
Thank you. You have some testimony that you'd like to deliver?
No, thank you.
Tell me a little more, Ms. Mack, about the veterans of the War on Poverty that you're getting ready to have.
Last fall, a group of citizens who have been very active in the War on Poverty, both at the national and the local level, got together for a dinner. And at that dinner decided that they would organize themselves into a group and participate with UPO in a number of activities that would celebrate the 35th anniversary of the establishment of UPO. And 3 activities have already been planned. There's going to be neighborhood celebrations, which you will be hearing more about, to just give neighborhoods an opportunity. It's called a community reunion, and it will give them an opportunity to come together and just talk a little bit about where we've come in those 35 years since the War on Poverty began, and really where we have to go in the new millennium, because while the War on Poverty had a number of successes, there's still a number of challenges that are being presented. We also will have a post-Labor Day event that will be sponsored by the Veterans of the War on Poverty and UPO, and we expect that to involve the entire community with developing an action plan, and also put the spotlight on some of our young people who really represent the leaders in this area as we go into the new millennium. And Councilmember Allen, we would be happy to have you join the Veterans of the War on Poverty. And Mr. Mendelson, I don't know if you are a veteran in that effort, but if you are, we certainly welcome you as well.
Thank you, Ms. Mack. Could you tell me how seniors get involved in United Planning Organization's part of the Office on Aging's programs?
Yes, in fact, let me tell you about the Weekend Meals Program, because that's one of the efforts where we have a great deal of participation by seniors. We have each Saturday and Sunday about 120 seniors who come to our Congregate Meals Program, and it really is just not food and fellowship. They get involved with things like fashion shows and out-of-town trips. They get involved with picnics and a great deal of recreational activities, and UPO, the UPO family, we like to call it, is very much involved in all the senior activities. For example, just last week, we had a senior fun day, and the entire UPO family was involved with the seniors in carrying out their programs. We work also through the DCOA lead agencies in order to make sure that our services are fully coordinated and that we are assisting the Office on Aging in every way we can to carry out their services.
If I wanted to participate in the UPO's part of the program, what would I have to do? Do I come to a center? I mean, how do I go about getting involved as a senior in the programs that the Office on Aging has helped finance through UPL? I guess intake, I guess that's the easier
Right.
They would,
Okay.
I'm sorry,
Go ahead.
we have DCOA have lead agencies, and citywide in the ward, they would contact the lead agencies would then prefer them to the appropriate services. For an example, if they wish to have transportation, they would call the lead agency. If it's in Ward 5, it would be Urban League 529-8701. Then Urban League would take the request in terms, fax it to WETS, and then it goes through that way. Thank you.
Thank you very much. Let me,
I think Mr. Thompson also
yes.
wants to add
I
something.
might also say, in respect to the weekend nutrition program and the senior home repair program, they may also call directly to UPO at 289-9100, extension 314.
Councilmember Mendelson, do you have any questions?
I don't. Thank you, though.
Thank you very much for your testimony.
Thank you.
And thank you for giving those phone numbers out. I'm quite sure that somebody caught that real quickly, so that UPO and,
I passed out
all right,
flyers
thank you.
in terms of it.
Calvin Fields, Jim O'Donnell from the University of the District of Columbia Institute on Gerontology. Good morning, gentlemen. Please identify yourself for the record and begin your testimony.
Good morning. My name is Clavin Fields. Councilmember Allen, thank you for permitting me to testify before you and members of your committee this morning. I live at 2031 34th Street Southeast in Washington, D.C. I am the director of the Institute of Gerontology at the University of the District of Columbia. The Institute of Gerontology provides gerontological training for persons who work with or desire to work with older persons. And
Would you please pull your mic just a little closer to you so that we can make sure it's recorded well?
And it implements a number of social service programs for older Washingtonians. I appear before the committee today to support the D.C. Office on Aging budget request. I begin by thanking Mayor Anthony Williams for restoring the $1.2 million to the Office on Aging budget, which represent most of the cuts from last year, and for retaining Ms. E. Veronica Pace in her position as Executive Director of the D.C. Office on Aging. The D.C. Office on Aging budget request is a modest one and should be approved without any reduction. However, while the D.C. government is proceeding with its economic recovery, supplemental funding should be approved each year for the Office on Aging until adequate funding is achieved for priority services. Additionally, the new funding level should factor in inflation costs. In your budget consideration, please do not forget that Washington, D.C. has the highest percentage of persons 65 years of age and over in poverty than any state in America, documented AARP, a profile of old Americans in 1998.
Thank you. Good morning, Chairperson Allen and Councilmember Mendelson, members of the staff. I'm Jim O'Donnell, a District of Columbia resident for 50-plus years. For about 12 years now, I've been an active participant in the BodyWise Senior Fitness Program and have served on the BodyWise Advisory Board for most of that time. I appear here today for the BodyWise Advisory Board and also for the Advisory Board of the Respite Age Program for Senior Citizens, which I'm serving as chair of. We thank you for this opportunity to comment on the FY 2000 budget of the D.C. Office of Aging, an agency which currently operates with a dedicated skeleton staff serving the needs, the health, the well-being of the district's senior population under the Older American Act as amended, and under D.C. Law 124. We wish to associate ourselves, I know later you're going to hear from Jim Nathanson of Iona Senior Services, we wish to associate ourselves with their position and also with the remarks just made by Claiborne Fields. Both Bodywise and the Respite Aid programs are funded in part by DCOA's annual budget. Both programs are cost-effective and health-effective. Bodywise has a proven track record of keeping older residents of D.C. fit and active in the community as volunteers at hospitals, churches, senior centers, mentors, and so forth. In the case of the Respite Aid program, its focus is on keeping the oldest of the old, the shut-ins, and those in need of in-house support, keeping them in their own homes, sparing them the experience of premature institutionalization with the attending expense that entails for families and the Medicare burdens the nursing home route imposes on our community. We commend our Mayor Anthony Williams for his reappointment of E. Veronica Pace as Director of the Office of Aging. Her seasoned hands-on leadership ensures that we keep intact the record of this agency, which has never overspent its budget, and one which focuses on seeing that the Senior Network and the Commission on Aging pull together and partner with the community in bringing quality programs and services to the senior population in every ward of the city. The effective advocacy of Mrs. Pace, I am sure, was a key to the Mayor's decision to restore to the agency's operating funds for the current fiscal year, with clearance from the Financial Control Board, the approximately $1.2 million by which the FY98 budget reduced funds for the Office of Aging's programs and services. As a result of this timely action, the annual Caregivers Conference for Family and Professional Caregivers, which conference had to be canceled last year for lack of funds, can again be planned for September 1999. Last year's reduction in the DCOA budget also meant that the Respite Aid volunteers had to be reduced from 31 to 25. Hopefully, these critical caregiving positions can now be again filled and continued in the budget for FY 2000. I'm at the end of the paragraph. We promise to keep this council informed about the maintenance of the District of Columbia swimming pools, so vital to the health of both the young and the old people. The pools at 3030 G Street Southeast, Therapeutic Pool in Anacostia. One of our commissioners from the Office of Aging is here this morning, Jane Vines, who's a regular participant there, and also the pool at Thurgood Marshall School in Northeast are in good repair, and our programs there are operating at near capacity. We are pleased that the cuts in funding of the Recreation Department are also being restored for the current fiscal year. This should help the natatorium and other pools. We thank you for your concern and your help. We urge you to support the Office of Aging FY 2000 budget without reduction. Thank you.
Thank you very much for your testimony. I have no questions of you. I believe that you stated quite a few things that we've done already or that are in the budget to help improve the life of our seniors, and we will look at the caregivers portion that you spoke about, the caregiving positions, and see if they're going to be filled in the year 2000, and we will do what we can to make sure that our seniors are well taken care of. I have no questions. Mr. Mendelson?
In leaving you, I also want to give an invitation and a plug for this Sunday's Bodywise annual fundraiser, which is the celebration of a centennial of Ellington and Gershwin at UDC. I'll leave them here and hope that either you or other members of the council can come by and be our guests.
Thank you very much. And the staff will pick those up so that we can read them. Mr. Jim Nathanson, Iona Senior Citizen. Good morning, Mr. Nathanson. Welcome to the council. You're in familiar ground.
Yes.
Would you please introduce the person who's at the table with you, and then you may begin your testimony.
Thank you, Ms. Allen. With me this morning is Sally White, who is the Assistant Executive Director of Iona Senior Services. Good morning. Chair Allen, members of the council, Councilmember Mendelson. And staff, thank you for giving us the opportunity to testify before your committee today. I am Jim Nathanson, President of Iona Senior Services, one of 6 lead agencies for the D.C. Office on Aging. Iona is responsible to the district and federal governments for assisting to plan and coordinate services for the elderly and to implement 13 specific grant-funded programs. Iona's D.C. Office on Aging service area covers all of Ward 3, part of Ward 1, and the western part of Ward 2. As president of the Iona Board for the past 3 years, and for 13 years as a legal counsel for the elderly representative payee and an Iona volunteer worker, I have learned a great deal about how our government does and does not serve its oldest residents well. The D.C. Office on Aging is a model for successful city, public, private, nonprofit, cooperative partnering. For more than 20 years, this partnership has very successfully supported a network of highly dedicated nonprofit service providers. But for Iona, the rapidly increasing elderly population and the past 2 years of reduced public funding for supporting that elderly population has meant reevaluating our priorities and reducing our program goals. We strongly recommend that the Council support a truly adequate budget for the Office of Aging, frankly, of $14 million, which is another 0.8 or $750,000 above the current baseline for the local budget. The proposed $13.3 million, while an increase of approximately $1 million over the 1999 local budget, and there is a restoration involved there, is still short of allowing programs to perform our needed mission of supporting our oldest citizens. Council addition of another $1 million will allow service levels to reach previous marks and in the end save the city money by preventing referrals to Medicaid-supported nursing home placement. And let me point out that at the previous levels, when the Office of Aging was operating very effectively, efficiently, as has been noted today, under the direction of the current new director, if you will, even then, the service levels left some holes. This recommendation is not without context. While the citizens of the district may have reasons to be proud of the Office of Aging, and we at Iona are extremely proud to be part of the Senior Service Network, we cannot overlook the harsh realities. Some services for the elderly have been increasingly fragmented, some services are barely functioning, and some services have been eliminated altogether. Grantee agencies, including Iona, must struggle to maintain quality services. Serious reductions of services to the elderly include abolishment of chore aid and home care programs, and you heard some about that earlier today, depriving 1,800 persons of services and decreasing hours for others from 9 to 3 hours a week. Privatization of the personal care aid program under Medicaid, creating new challenges for coordination and monitoring of services. Abolishment of the Central Referral Bureau, responsible for referrals to licensed and residential facilities. Elimination of several Office of Aging services, including the innovative arrangement for providing electronic emergency response devices to low-income seniors. These reductions directly impact Iona's clients, as well as others in the city. As the average age of older people in the Iona service area has increased, so too has the need for personalized attention for the steadily increasing numbers of people seeking help. Over the last 2 years, the Office of Aging grant to Iona was cut significantly, $125,000. There are now discussions about restoring a piece of that cut consistent with the restoration of the $1.2 million. And currently, we will probably receive a restoration of approximately $50,000, which is $75,000 less than what we in fact were cut. And similar in the other lead agencies will suffer the same consequences, even though life will get a little better. Iona was forced to reduce our counseling program from almost 13,000 hours to just over 9,000 hours. Even with the assistance of volunteers, we could not offset these gaps caused by these cuts in our grant. We had to close out our only activity and lunch program in the DuPont Circle area. Although the program was extremely important to the participants, we were financially unable to maintain it in the face of these reductions. Iona supports the capital budget request of $3.4 million for the construction of 2 new senior wellness centers in Wards 4 and 6, and certainly the construction of the center in Ward 8. These are the types of services we owe to these elderly citizens who have contributed so much to our communities. And we urge the Council to pass a full $14 million local budget to provide truly adequate support for our older citizens. Thank you, Mrs. Allen.
Thank you, Mr. Mendelson, for your... Mr. Mendelson, okay, I'm sorry. Mr. Nathanson, for your testimony this morning. We would love to, if we could find more money in the budget, to put it into the Office on Aging's budget. But having been a council member, I don't know what the process was when you were here. We have a mandate now that for every penny we spend, we have to find it. I'd love to be able to add more money to the Office on Aging's budget, but I have to find it someplace in the actual budget. I know you heard me speaking with Ms. Pace about we're working with 2 budgets right now.
Right.
But we are working with 2, a real one and a wish list. So the addition goes in the wish list, and we will definitely put it there into the wish list budget if Congress will allow us to use our reserve of $150 million, then we'll be able to do a lot of things that we would really like to do for the citizens of the District of Columbia. It's wonderful to see you very active in community services. See, some of us have it in our blood. We just don't go in the house. We don't stop helping other people to live good, fruitful lives. And I have no real questions, but I want to let you know that if we come up with, if the wish list budget ends up being the real budget, then we will add more money into the Office on Aging's budget.
I appreciate that, Madam Chair. And I just wanted to comment on the $14 million level, frankly, because this is an office that during all this history of supposed inefficiency and some proven inefficiency in many of our agencies and departments who seem to operate at whatever level, irregardless of what money they did or did not get, this is an agency which has operated efficiently, effectively. Ms. Pace spoke about the administrative costs of her office, the percentage, what was 7%, that kind of thing, the overhead cost. This is an office which has proven itself, as it should have, because it has a clientele which has deserved every penny that has ever been spent on it. And so I just thought it was important to put that into the record.
Well, thank you very much. Do you have some testimony that you wish to give? All right. Well, thank you for joining, Mr. Nathan. Mr. Mendelson, do you have some questions?
Not really. I just want to acknowledge that Jim, since you were my former boss, I hear you, and thank you for being here.
Thank you very much.
Thank you.
Greater Southeast Center for Aging. Would the witnesses please come forward? Good morning.
Good morning.
Would you please identify yourselves for the record and then begin your testimony?
Good morning. My name is Diana Ginyard, and I'm the Vice President for Community Aging Programs and Services of Greater Southeast Center for the Aging. It's a subsidiary of the Greater Southeast Healthcare.
Please pull your mic up so that we can hear you.
Okay. Of the Greater Southeast Healthcare System. I bring you regards from the Board of the Directors and Dr. George Gilbert, who is the Greater Southeast Healthcare System CEO at this time. The Center for the Aging has been a part of the Office on Aging since 1978, when the Multi-Service Senior Center was developed by the Greater Southeast Hospital Foundation. It was developed in response to an identified yet unmet community need for a comprehensive approach to the aging elderly residents. During these years, we have witnessed and participated in the development of the best area agency, aging agency in the country. Mrs. E. Veronica Pace and her dedicated commissioner and staff have served the District of Columbia elderly resident well. Throughout the Center for the Aging, 3 community-based programs, the Multi-Service Senior Center, Project King Comprehensive Senior Centers, and the Washington Senior Wellness Center, an array of comprehensive services have been established to enhance the quality of life for older persons. A primary focus is helping the elderly to live with maximum independence and dignity in a manner consistent with the goals of the Older American Act of 1965 as amended. Approximately 3,000 program participants are being served throughout different programs. These services which they are being provided include nutrition programs, home-delivered meals 7 days a week, transportation, health promotion, assessment case management, counseling for participants and family members, Alzheimer's caregiver support, and call and ride. There are also a variety of other programs which include sewing, respite care, information and referral, literacy program, crisis intervention, and social recreation activity at 10 different senior sites. DC Office on Aging is the major funding source for the Center for the Aging, which serves the elderly population east of the Anacostia River in wards 6C, 7, and 8. The Center for the Aging serves as the DC Office on Aging lead agency for wards 6C and 7. Throughout the years, DC Office on Aging has provided support to the Center for the Aging's mission, and through program enhancements is equipping us to go forth into the coming millennium. Joining me today are 2 participants who will be briefly sharing benefits they are receiving from the DC Office on Aging Senior Network. In closing, the funds budgeted and earmarked for the DC Office on Aging are needed, well-mannered, and have allowed many of the DC elderly volunteers and agencies to provide comprehensive services. The panelists from the Center for the Aging thank the Committee on Human Services for the opportunity to express our support of the DC Office on Aging funding for FY 2000.
Good morning.
Good morning.
Honorable Chairperson Sandra Allen, member and staff of the Human Service Committee. My name is Addie Good. I attend the Multi-Service Senior Center at Greater Southeast Community Center for the Aging 5 days per week. I enjoy coming to the center for many reasons. One, the center offers many different activities that I enjoy, such as arts and crafts, mind stimulation games to keep me up on current happenings, and discussion groups. We attend many trips, and different speakers and groups come to speak to us and entertain us. 2, the center offers a good lunch. I also get health service and teaching from the staff. I get weighed every month and my blood pressure taken upon request every month. 3rd, I am close to my doctor's office. I am escorted to my appointments and I have someone to pick up my prescription when I need them. 4, I need the center and the people. I need to get out every day and be with people just to keep my mind clear. The center has helped me a great deal. It is like being a part of a big family. This year I was crowned Queen of Hearts, MSSC. We had a sweetheart contest for Valentine's Day. In conclusion, we really need the center. Please continue to give us funds because we appreciate and need what is being done by this great program. Thank you for the funding you have provided through the DC Office on Aging, and I am respectfully requesting that the budget for fiscal year 2000 be maintained at the present level. Again, thank you for this opportunity.
Thank you.
Good morning, Chairperson Sandra Allen and members of the Human Service Committee. I am Ms. Viola Wright, a native Washingtonian born in Georgetown. I have been fortunate to have raised one son, Roland Taylor, former pro player for the Denver Nuggets, grandson Charles Smith, who played for the Boston Celtics and is now playing in Italy, one grandson who goes to the University of Pittsburgh, another one who goes to Eastern Shore, who have reaped the benefits of services offered by the district government. It is now my turn as a senior citizen to be an active participant in district services. I am second vice president of the Far Northeast Boundary Civic Association, and I am also a participant in the Project King program, which operates at the Kenilworth Parkside Senior Center in Northeast DC. I am very grateful for the programs and services offered by CFA Project King, which is funded by the Office on Aging. One of the programs which have proven to be beneficial to me and many of the other residents of Wards 6C and 7 is the lunch program. This program gives us an opportunity to enjoy a nutritious meal 5 days a week. We are also fortunate to be able to participate in several mental, physical, spiritual, and social activities. There are weekly classes which address the nutritional health management components. We have lectures by our peer instructors as well as our nutritionists. Blood pressure is taken weekly, also when necessary. Weight management and exercise are also offered. I am able to participate in ceramics, computer literacy, sewing, bowling, and golf. We are blessed to have vans to transport seniors to the various programs and on trips as well to special events. CFA Project Teen also provides other services, namely homebound meals, social service intervention, literacy training, computer training, exercise and fitness, respite care, and Alzheimer's support. The primary goals are to foster more healthful and productive lifestyles for the seniors. Project King serves more than 800 participants daily. As an active senior participant in the Project King program, I come before you on behalf of the senior populace of Wards 6C and 7, thanking you for restoring the $2 million in funding to the D.C. Office on Aging. I am sure Project King will use it shared wisely. Thank you for this opportunity to speak.
Thank you, all three of you. I'd like to ask Ms. Ginyard, I see the Project Teen serves 800 participants daily. That's meals. How many people are in your program totally?
We have approximately 3,000 in our three different centers, unduplicated count that's receiving services throughout the year.
That's a lot of seniors. All right, just wanted to make sure because I knew it was more than 800.
Oh, yeah.
I was trying to find out what the combined number. I have no questions, and I see you often. And I see the services that are being delivered, and it's good to know that part of the funds come out of the Office on Aging. Do you have any questions, Mr. Mendelson?
I don't. I just want to thank you for being here.
Thank you.
Thank you. Ms. Gloria Catlett. Would you please identify yourself for the record?
I'm Gloria Catlett, a volunteer at the Friendship House Senior Network Program.
Ms. Catlett, please pull your mic close to you so that you can be heard. And at the table with you, Ms. Catlett, is?
Mrs. Brenda Reynolds, the director of the Friendship House Senior Network Program.
Thank you. You may begin, Ms. Catlett.
Good morning, Chairperson Sandra Allen and members of the Committee on Human Services. I am Gloria Catlett, representing Friendship House Association in support of D.C. Office on Aging Budget Year 2000. Our service areas consist of Ward 2 southwest only and Ward 6 west of the Anacostia River. As a volunteer and senior participant, I have had an opportunity to experience Aging Resources' impact on senior citizens. Friendship House provides a broad range of services to approximately 1,300 seniors daily in the Capitol Hill area. On the days I volunteer 3 times per week, I'm responsible for calling homebound seniors to monitor their well-beings. I discuss program satisfaction and all needed changes along with additional services. If the senior is unable to communicate by telephone, the same discussion is shared with family member or caretaker. At least 20 calls are logged during this time. The responses from participants are deeply appreciative. Most welcome calls and services because at times this is the only connecting link to the outside world. A frail elderly becomes part of the program until services are no longer needed. A recent family member of a deceased senior sent a correspondence on behalf of the senior's friends with this following information. Dear folks, and I quote, Mrs. Almarta D. Mullen received meals through your service from 1994 to March 1995. I'm sorry. Received meals through your service from 1994 to March 1999. This service was invaluable to Ms. Mullen and the family. It was one of the reasons Ms. Mullen was able to remain in her own home until her passing March 25, 1999. 2 of her friends made contributions to the Friendship House in her memory. Mrs. Mullen, end of quote. Sincerely, Mrs. Sandra Mullen Barrett. Other services offered received similar accolades from seniors and family members. The good news, senior residents throughout the District of Columbia benefit from quality service. As we prepare for the new millennium, DC Office on Aging is on the forefront exploring and implementing new approaches to reach the up and coming baby boomers, that is, wellness centers and computer labs. Today's seniors are introduced to cyberspace on the internet. We take advantage of classes at local community-based computer centers. Soon, we will join other programs with our own computer workstation. In this way, we can continue to practice learned computer skills. A great majority of us do not have computer skills nor computer in the home. New research reveals 30% of seniors own and use a computer. This number drops dramatically as Americans age, with only 16% of those aged 70 through 79 and less for 80-plus years. I urge you to maintain DCO. Thanks to the Restore $1.2 million in funds to aging budget, many emergency and critical needs of seniors will be continued. I urge you to maintain DC Aging Department as a cabinet level and fully funded to advance aging quality of life for our most vulnerable citizens, senior citizens. Thank you.
Thank you very much. Did you have some testimony? No. Thank you very much for your testimony, Ms. Catlett. How many people are in your computer classes that's going into cyberspace?
Right now, we have 10 that are actively involved, and we have another set that's waiting to join.
You may have 11.
Okay.
All right.
Okay.
We all need to learn how to be in cyberspace, so you may have another one joining you.
Okay.
I have no questions. Mr. Mendelson? Thank you, Ms. Catlett, very much. Thank you for your testimony. Is there anyone here whose name we did not put on the witness list that wishes to testify? If not, this hearing is adjourned.
The Office on Energy's hearing will start in 5 minutes.